most people will have a normal, healthy pregnancy, but there are many things that can go wrong even with a full-term delivery. The cord can come out before the baby. You can have the placenta pull away from the uterus. You can have a baby that has its umbilical cord wrapped around its neck. Those are all times when you need to be in a hospital and have somebody who knows how to deal with taking care of those babies at delivery. If your baby's delivered here at Stormont-Vail, you will be in the same facility as your baby as long as baby doesn't need some type of surgical procedure. If you deliver at a different facility and there's a problem and you would need a level 3 NICU, mom would be in one hospital and baby would be transferred to another hospital. So then mom and baby are split up until it's safe to release mom from the hospital. So then you have a dad who's stressed, who's trying to go between two hospitals, split his time, and just adds a whole lot more stress to the family.
Knowing that should catastrophe strike, we didn't have to hop in an ambulance. He could just be whisked away in a matter of seconds. In our class, we talked about how brain damage happens within after the first 10 seconds of not having oxygen. And knowing that should something happen, heaven forbid, like that, having a NICU right there means that there's a much higher likelihood of him coming through something like that well.
Our first daughter was born at 36 weeks, so that is preterm. So knowing that there was a NICU here if she needed it, which she didn't, was really reassuring. We did have access to all of the NICU staff. One of the nurses worked with us on getting her to eat, and it definitely put peace of mind for us and for her. If she needed the treatment, it was available here.
During that whole process, when I was delivering him, I was asleep. So I was really that sick from the preeclampsia that he could not be awake.
I think he was so small that he could fit like just one hand. Well, at least my hand. He was that small. I knew it was a process. I'm not gonna lie, it was hard seeing him in that moment, especially my wife. She was going through the C-section.
We have a picture, it's really sweet, of me reaching inside the incubator and touching his hand, and you could barely see like a faint smile on my face, but I was really, really happy. And sorry. It's okay.
You okay? I just appreciate everything that she went through. She did it for our son, and she's the strongest person I know, so parents should expect you're gonna be very emotional, you're gonna be very appreciative, and I think anybody that has a baby here, your baby gonna be taken good care of. He's gonna be in good hands. It could have been a hard time for us, but it really wasn't. It's some of the best times of our life, so we appreciate everything they've been doing for us.
To see my son doing so well, it makes me feel happy. To see him every day going in there, he looks, he's getting those chubby cheeks, and where he started from, it's kind of feels like it's gonna be a really long journey, but it goes by faster than you think. And I know one day we're gonna look back and be like, that went by so fast, and we're really grateful for all the nurses, and I'll never forget them. I'm gonna take pictures of them so Elisha can see them too, and so he can know who took care of him and helped us fight through this hard time.